Good afternoon, dear students. I am very glad to see you today at our English lesson. I hope you are fine today. The theme of our lesson is mumps. Mumps is epidemic parotitis. It is an acute viral disease with an aerosol transmission mechanism accompanied by intoxication and damage to the glandular organs, mainly salivary, as well as the nervous system. Mumps infection, also known as epidemic parotitis, and in popular literature, mumps or mumps, a viral disease that affects mainly children aged 5 to 15 years. The etiology of this disease is causative agent of mumps infection is an RNA-containing virus. The virus is viable to 20 Celsius for 6 days, at 4 Celsius up to 1 month. Sensitive to ultraviolet radiation, exposure to 2% formalin in 1% Lysol solution dies after 5 minutes. The main epidemic signs. The disease is widespread. It rises in incidence every 7-8 years. Males get sick more often and harder. In children's institutions, the disease occurs in the form of outbreaks. The incubation period is from several days to a month, usually 18-20 days. Prodromal period, most often in children, 1 to 3 days. Manifested by slight intoxication. Dry mouth, unpleasant sensation in the region of the parotid salivary glands. In typical cases, an acute onset of the diseases is observed with an increase in body temperature up to 38-40 Celsius, and the appearance of signs of general intoxication, pulling pains, and feelings of tension in the parotid region, and tinnitus. Fever most often reaches its maximum severity on the 1-2nd day of illness and lasts for 7 days, followed by a decrease in the type of shortened lysis. Prevention of this disease is isolation at home or hospitalization if indicated in the infectious disease ward. The term of isolation is 9 days from the beginning of the clinical manifestations of the disease. Children who have been in contact with patients and who have not previously had epidemic parotitis are isolated for 21 days, and if the contact time is previously established, children are allowed into children's institutions in the first 10 days of incubation, and from 11 to 21 days they are isolated from other children.
Mumps is a contagious viral infection caused by the paramyxovirus. The virus is spread through contact with infected saliva. When an infected person sneezes or coughs, moisture droplets spray into the air. The virus is spread by coming in contact with these infected droplets. Following exposure to the mumps virus, there is usually an incubation period lasting 14 to 24 days, during which no signs of the disease are present. During this time, the virus begins to multiply in the cells of the upper respiratory tract and lymph nodes, increasing the levels of virus circulating in the bloodstream. The first symptoms of mumps are chills, headache, and a general feeling of malaise. A temperature of up to 104 degrees Fahrenheit can also develop. This is followed in 12 to 24 hours with swelling of the salivary glands. The glands are usually tender to touch and cause pain when chewing or swallowing. Complications from mumps can include deafness, meningitis, or nerve damage. In boys or men who contract mumps, painful swelling of the testicles can also develop. An effective vaccine for mumps is available and is usually given in combination with vaccines for measles and the less severe German measles or rubella. This MMR vaccine is given to all children following their first birthday, with a second dose usually given before entering school. The MMR vaccine should not be given to pregnant women.
And now I have some questions for you. Please listen it very attentively and try to answer. How serious is mumps in adults? What are the signs of mumps in adults? How long do mumps symptoms last? And do mumps go away on their own?